Today we're going to be talking about the synovial joints and their functions with my model Dana. The first synovial joint we're going to be talking about is the ankle, and the anatomical name for the ankle joint is the talocrucial joint. The type of joint is the synovial hinge joint. A little example. The specific movements of the ankle joint are plantar flexion, which is down, dorsiflexion, which is up, eversion, which is left, I know it's kind of hard to see, and inversion, which is right. The range of motion on the sagittal plane is 65 to 75 degrees, and the range of motion on the frontal plane is 35 degrees. And the degree of freedom is only 1. So, as if we were moving too far left or right, our ankle would break. Alright, next we have the knee joint, and the anatomical name for the knee is the tibiofemoral joint. The kind of joint is the synovial hinge joint. Like a hinge. The specific movements are flexion and extension. It's a squat or jump. Squat, jump, squat, jump. Okay. The range of motion is when the knee is extending is 0 degrees. The range of motion when the knee is flexing is 140 degrees. Both are performed in the sagittal plane. And the degree of freedom is 6 degrees according to the Baylor Medical website that I looked up. The next synovial joint we'll be talking about is the hip, also known as the iliofemoral joints. The type of joint is a ball and socket type joint. So this is kind of an easy example to look at. The specific movements of the hip joint are flexion and extension, forward and back, abduction and adduction, going left to right, and circumduction, more of a circle-like. The hip flexion is the range of motion of 120 degrees on the sagittal plane. And the degree of freedom is 3 degrees. Moving on, we're going to be talking about the shoulder. The anatomical name is the glenohumeral joint. There's also a synovial ball and socket, similar to the hip, same motion. The specific movements are flexion and extension, abduction and adduction, and internal and external rotation. The range of motion during the flexion is 180 degrees, and both the extension and internal rotation is 70 to 90 degrees. External rotation is 90 degrees, and abduction is 150 degrees, which is all performed on the sagittal plane together. The degree of freedom of the shoulder joint is 3 degrees. Alrighty, next we're going to be talking about our elbow. There's actually 3 joints in the elbow, and their anatomical names are humeral ulnar, humeral radial, and radial ulnar joints. It is a hinge joint, just like the knee and the ankle. And the specific movements include flexion and extension, and the rotation of the radius. The range of motion during extension is 0 degrees, and flexion is at 150 to 160 degrees, located at the humeral ulnar hinge axis. The degree of freedom is 2 degrees in the elbow. Next we'll be talking about the wrist joint. The anatomical name is the radiocarpal joint. And it's the synovial condyloid joint, which is a modified ball and socket joint. So it's not quite the same as the same ball as the hip and shoulder. The specific movements include flexion and extension, and adduction and abduction. The range of motion of the joint is during flexion 50 degrees, and during extension 35 degrees. Abduction and adduction total 37 degrees in the sagittal plane. There are 2 degrees of freedom in the wrist joint. And finally, we'll be talking about the cervical spine joint. The anatomical name is the atlantoaxial joint, and it's a synovial pivot joint this time. The specific movements are flexion and extension, lateral flexion, and rotation. The range of motion during flexion is 80 to 90 degrees, extension is 70 degrees, and there are 20 to 45 degrees during lateral flexion, and rotation is 90 degrees. They are all in the sagittal, frontal, and transverse planes, and there are only 2 degrees of freedom in the cervical spine joint.